What ethical considerations should be taken into account when administering psychological tests, particularly in diverse populations? Answer: when administering psychological tests, ethical considerations are paramount to ensure fairness and accuracy. Key aspects include informed consent. Test administrators must ensure that participants fully understand the purpose of the testing, the procedures involved, and any potential risks. This is especially crucial for diverse populations that may have varying levels of understanding regarding psychological assessment. Cultural sensitivity. It is essential to consider cultural differences that may affect test performance. Tests should be valid and reliable for the population being assessed. Using culturally biased tests can lead to misinterpretation of results and harm to the individuals being tested. Confidentiality. Maintaining the confidentiality of test results is critical. Administrators must ensure that sensitive information is securely stored and only shared with authorized personnel per guidelines such as the American Psychological Association, APAP, Ethical Principles of Psychologists, and Code of Conduct. Competence. Test administrators must have the appropriate qualifications and training to administer and interpret psychological tests accurately. This includes ongoing education on new testing methods and ethical standards. Feedback. Providing constructive feedback to participants about their test results is essential. This allows for informed decision-making and supports the participants' understanding of their own psychological profile. Dealing with test anxiety. Ethical practice also includes strategies for managing test anxiety among participants, ensuring that anxiety does not skew results. By adhering to these ethical considerations, psychologists can provide fair and effective assessment while safeguarding the rights and welfare of participants. Describe the differences between hand scoring and computerized scoring of psychological tests and discuss the advantages and disadvantages of each method. Answer: hand scoring and computerized scoring are two methods used to evaluate psychological test responses. Both methods have distinct advantages and disadvantages. Hand scoring: advantages, control over the process. Psychologists can closely monitor the scoring process, which allows for nuanced interpretations and adjustments based on context. No technical failures. There are no risks of technical malfunctions that can occur with computerized systems. Disadvantages: time-consuming. Hand scoring can be labor-intensive and time-consuming, especially for lengthy assessments. Subjectivity. There is potential for human error or bias in scoring, which can affect the reliability of the results. Limited availability of immediate feedback. Test results take longer to be processed and communicated. Computerized scoring. Advantages: efficiency. Computerized scoring is typically faster and allows for immediate generation of results. Standardization. Computer algorithms ensure consistent scoring, reducing the potential for human error and bias. Advanced analysis. Computerized systems often provide advanced statistical analyses and data visualization tools that can enhance interpretation. Disadvantages: dependence on technology. Technical issues, software malfunctions, or power outages can disrupt the scoring process. Limited interpretation. Computerized scoring may not always account for contextual factors or nuances that a trained psychologist might consider. Cost. The initial investment in scoring software can be high, and ongoing maintenance and updates can incur additional costs. Mr. Thompson is a school psychologist who recently encountered a situation where a student's test scores showed significant discrepancies between performance-based assessments and standardized tests. How should Mr. Thompson approach interpreting these scores? Answer: Mr. Thompson should approach this situation with a comprehensive and multifaceted strategy. Understanding score discrepancies. Mr. Thompson should first analyze the nature of the discrepancies. Performance-based assessments may reflect the student's practical skills and knowledge in real-world contexts, while standardized tests often measure more abstract reasoning and knowledge. It's important to consider the constructs being assessed and whether they align with the student's strengths. Contextual factors. Mr. Thompson should consider factors that may affect the student's performance, such as test anxiety, learning disabilities, or environmental influences, e.g., classroom dynamics, home environment. Gathering qualitative data through interviews with teachers and parents may provide valuable insights. Score distribution analysis. Understanding the distribution of the scores can aid in interpretation. For instance, if the performance-based score is significantly higher than the standardized test score, it might suggest that the student thrives in practical applications but struggles with traditional testing formats. Utilizing percentile ranks and standard scores, Mr. Thompson can convert raw scores into standardized scores to evaluate how the student performs relative to peers. By comparing percentile ranks, he can identify whether the student's performance is above or below average in specific areas. Collaborative decision-making, engaging a multidisciplinary team, including teachers, special educators, and counselors, can help develop a more holistic view of the student's abilities and needs. This collaborative approach will ensure that interpretations are not made in isolation. Recommendations for future assessment. Mr. Thompson may suggest alternative assessment methods that could better capture the student's abilities. This could include using curriculum-based assessments or dynamic assessment techniques that evaluate learning potential. By considering these factors, Mr. Thompson can provide a more accurate and nuanced interpretation of the student's test scores, ultimately leading to better educational support and interventions. Explain the significance of percentile ranks, standard scores, and stanines in the interpretation of psychological test scores. Answer: understanding the significance of different score types is crucial in psychological assessment. Percentile ranks. Percentile ranks indicate the percentage of scores that fall below a given score in a distribution. For example, a student in the 75th percentile scored better than 75% of peers. Percentile ranks provide a relative measure of performance, which can help in identifying where an individual stands compared to reference group. Application. Psychologists can use percentile ranks to communicate test results in a manner that is easily understandable to non-professionals, e.g., parents, educators. Standard scores. Standard scores, such as Z-scores or T-scores, allow for the comparison of an individual's performance to a normative sample. A standard score expresses how far in standard deviations a score is from the mean of the distribution. For instance, a Z-score of 1 indicates that the score is 1 standard deviation above the mean. Importance. Standard scores enable comparisons across different tests and populations. They are essential for identifying outliers or individuals who may need special attention. Stanines. Stanines are a wave scaling scores on a 9-point scale with a mean of 5 and standard deviation of 2. Scores are categorized as follows: 1, 3, below average 4, 6, average 7, 9, above average utility. Stanines simplify score interpretation, making it easier to categorize and communicate results to various audiences. They are particularly useful in educational settings for assessing student performance against grade-level expectations. Understanding these scoring methods is critical for interpreting psychological test results effectively, guiding decisions related to intervention, and communicating findings clearly with stakeholders. Discuss the methods for dealing with missing data in psychological assessments and the implications of these methods on the validity of test results. Answer: dealing with missing data is a common challenge in psychological assessments. The methods for addressing missing data can significantly impact the validity of test results. Deletion methods. Listwise deletion involves excluding any case with missing data from the analysis. While this method is straightforward, it can lead to biased results if the missingness is not completely random. Pairwise deletion only excludes cases with missing data for specific analyses. This allows for more data use but can complicate interpretations and comparisons across analyses. Imputation methods. Mean substitution, replacing missing values with the mean of the observed values. This can artificially reduce variability and lead to underestimation of standard errors. Regression imputation, predicting missing values based on available data through regression models. This method can preserve relationships between variables, but may introduce bias if the underlying assumptions are violated. Multiple imputation involves creating multiple datasets by imputing values based on statistical models and combining results for final analysis. This approach accounts for uncertainty due to missing data, offering more robust estimates. Sensitivity analysis. Conducting sensitivity analyses helps evaluate how different missing data handling methods affect results. By comparing findings from various approaches, psychologists can assess the robustness of their conclusions. Reporting and transparency. Psychologists should transparently report the handling of missing data in test results. This includes detailing the percentage of missing data methods used and any potential biases introduced. Choosing the appropriate method for handling missing data is critical as it can influence the validity of psychological assessments. The implications of these methods should always be carefully considered in the context of the specific test, the population being assessed, and the research or clinical objectives. What are the guidelines for reporting and communicating test results to different audiences, such as parents, educators, and clinicians? Answer: when reporting and communicating psychological test results, guidelines vary based on the audience's needs and understanding. For parents, clarity: use layman's terms to explain results, avoiding jargon. Parents should understand their child's performance relative to peers. Contextualization: Frame the results within the child's overall development and functioning, including strengths and areas for improvement. Actionable recommendations. Provide specific, practical suggestions for supporting the child's learning and development at home. For educators, detailed analysis. Educators often benefit from a deeper understanding of test results, include statistical data such as percentile ranks and standard scores. Collaborative approach. Encourage dialogue with educators about interpreting results and developing tailored interventions in the classroom. For clinicians, comprehensive reports. Clinicians require thorough reports that include test administration details, scoring methods, and interpretation frameworks. Focus on implications. Emphasize the clinical implications of the results, including diagnosis, treatment options, and potential interventions. Cross-disciplinary communication. Encourage collaboration with other professionals involved in the individual's care, ensuring a cohesive approach to treatment. General guidelines. Confidentiality. Always maintain confidentiality and discuss results in a private setting. Visual aids. Use graphs, charts, or tables to present complex data clearly. Feedback mechanism. Provide a way for the audience to ask questions or seek clarification about the results. Adhering to these guidelines helps ensure that test results are communicated effectively, facilitating understanding and informed decision-making among all stakeholders involved. What strategies can be employed to manage test anxiety in participants during psychological assessments, and how do these strategies impact test performance? Answer: managing test anxiety is crucial to ensure that participants can demonstrate their true abilities during assessments. Here are effective strategies. Pre-test preparation. Familiarization with test format. Providing participants with information about the test format and types of questions can alleviate anxiety related to the unknown. Practice tests. Offering practice tests can help participants become accustomed to the assessment environment, reducing anxiety. Relaxation techniques. Breathing exercises. Teaching participants control breathing techniques can help calm nerves before and during the test. Mindfulness and visualization. Encouraging mindfulness practices and positive visualization can help participants focus and reduce anxiety levels. Test environment optimization. Comfortable setting. Ensure the testing environment is quiet, comfortable, and free from distractions. This can promote a sense of safety and focus. Adequate time. Providing ample time for the test can alleviate pressure and allow participants to work at their own pace. On-site support. Accessible support staff. Having trained personnel available to provide support or reassurance can help manage anxiety during the assessment. Breaks during testing. Allowing short breaks during lengthy assessments can give participants time to regroup and reduce stress levels. Feedback mechanism. Offering participants feedback after the test can help them understand their performance and alleviate concerns regarding their results. Impact on performance. Effective management of test anxiety can lead to improved performance as participants are better able to focus on the tasks at hand rather than being distracted by anxiety. Reducing anxiety can lead to more accurate assessments of a participant's true capabilities, ensuring that results reflect their abilities rather than the effects of stress. How can understanding score distributions, including normal and skewed distributions, influence the interpretation of psychological test results? Answer: understanding score distributions is vital for accurately interpreting psychological test results. Normal distribution. In a normal distribution, scores cluster around the mean, creating a bell-shaped curve. Approximately 68% of scores fall within one standard deviation of the mean, 95% within two, and 99.7% within three. The empirical rule. Implications. A normal distribution allows psychologists to apply statistical methods for comparison, making it easier to interpret how an individual's score relates to the larger population. Scores can be converted to z-scores to standardize comparisons. Skewed distribution. A skewed distribution occurs when scores are not symmetrically distributed around the mean. Positive skew, right-tailed, indicates that most scores are lower with a few high outliers, while negative skew, left-tailed, indicates that most scores are higher with a few low outliers. Implications. In a skewed distribution, traditional interpretations may be misleading. For example, if a test score is in the 90th percentile of a positively skewed distribution, it may not indicate superior performance, but rather an absence of high scores in the group. Psychologists must consider the nature of the distribution to avoid incorrect conclusions about an individual's abilities. Analyzing the shape of the distribution provides context for interpreting test scores and informs clinical decisions. Statistical techniques. Understanding the distribution type allows psychologists to select appropriate statistical techniques for analysis. For normally distributed data, parametric tests can be employed. For skewed data, non-parametric tests may be more suitable. The choice of statistical analysis has significant implications for the validity and reliability of conclusions drawn from test results. In summary, a thorough understanding of score distributions enhances the interpretation of psychological assessments and informs effective decision-making in clinical and educational contexts. What are the guidelines for interpreting test scores, particularly in understanding percentile ranks, standard scores, and raw scores? Answer: interpreting test scores involves understanding various score types and their implications for assessment. Raw scores. A raw score represents the actual number of points earned on a test. It is the most basic form of scoring but lacks context. For example, a raw score of 75 out of 100 does not provide information on how this score compares to others. Guidelines for interpretation. Raw scores should be viewed in conjunction with normative data to understand their significance. Percentile ranks. Percentile ranks indicate the percentage of test takers who scored lower than a given score. For instance, a percentile rank of 80 means the individual scored better than 80% of peers. Guidelines for interpretation. Percentiles provide a relative understanding of performance within a group. They should be interpreted in light of the normative sample used for comparison, and users should be cautious not to overinterpret small differences in percentile ranks. Standard scores. Standard scores, such as t-scores or z-scores, express an individual's performance relative to the mean of a normative sample. A z-score indicates how many standard deviations a score is from the mean. A z-score of 2 indicates performance 2 standard deviations above the mean. Combining scores for comprehensive interpretation. Psychologists should avoid relying solely on one type of score. Instead, integrating raw scores, percentile ranks, and standard scores provides a comprehensive understanding of an individual's performance. Communicating results. When reporting scores, psychologists should be transparent about what each score means and how it can be used for decision-making, particularly in educational or clinical settings. Explain the importance of writing test reports for various audiences, including the specific elements that should be included for clarity and effectiveness. Answer: writing test reports is a critical component of psychological assessment. Reports should be tailored to the audience's needs, ensuring clarity and effectiveness in communication. Key elements to include are demographic information. Include relevant demographic data, age, gender, background to contextualize results. This helps readers understand the individual's background and how it may influence test performance. Reason for referral. Clearly outline why the assessment was conducted, including specific concerns or objectives from the referral source, e.g. school, clinic. Assessment methods. Describe the tests administered, including their purpose, reliability, validity, and administration procedures. This transparency helps the audience understand the context of the results. Test results. Present raw scores, percentile ranks, standard scores, and any other relevant metrics. Use clear charts or graphs to visualize data for easier comprehension. Interpretation of results. Provide a thoughtful interpretation of the scores. Discuss strengths and weaknesses as well as potential implications for the individual's development, learning, or clinical needs. Recommendations. Offer specific, actionable recommendations based on the test results. Tailor these to the audience. For example, suggestions for parents might include strategies for home support, while recommendations for educators could focus on instructional adjustments. Confidentiality statement. Emphasize the confidentiality of the report and who it may be shared with, adhering to ethical guidelines. Appendices or additional resources. If applicable, include supplementary information such as additional resources for parents or educators or more detailed explanations of the assessment tools used. By incorporating these elements, psychologists can create effective test reports that not only convey essential information but also facilitate understanding and informed decision-making among various audiences. What is the relationship between test reliability and test length, and how does test length impact reliability? Answer: test reliability, defined as the consistency of a test in measuring what it intends to measure, exhibits a positive relationship with test length. As the length of a test increases, its reliability typically improves due to several reasons. Greater content sampling. A longer test incorporates a wider range of items, allowing for a more comprehensive assessment of the trait being measured. This broader sampling reduces the impact of random errors associated with individual items, thereby yielding more stable scores. Statistical variability. The more items included in a test, the greater the likelihood that the total score will reflect the true score of the individual rather than random fluctuations. This is based on the idea of central limit theorem, which posits that the average of a large number of items tends to converge on the true mean reliability coefficient increase. The Spearman-Brown prophecy formula can be used to estimate how reliability increases with test length. This formula provides a prediction of the reliability of a longer test based on the reliability of the shorter version. Diminishing returns. It's important to note that the increase in reliability due to lengthening the test is not linear. After a certain point, adding more items yields diminishing returns in reliability. This means that a very long test may not significantly increase reliability compared to a moderately long one. Guideline rule. For psychological tests, maintaining an optimal length is crucial. Research suggests that a test should ideally have at least 1015 items for reliable assessment of personality traits, abilities, or other psychological constructs. How does test-retest reliability differ from alternate forms reliability, and when should each be used? Answer: test-retest reliability measures the consistency of test scores across time by administering the same test to the same group of individuals at two different time points. This approach assesses the temporal stability of the test, particularly useful for traits assumed to remain relatively stable, such as personality traits or cognitive abilities. Key considerations for test-to-test reliability: interval between tests. The time interval between the two administrations should be appropriate. A too short a duration might result in practice effects, while too long may lead to actual changes in the construct being measured. Calculation. The correlation between the two sets of scores is calculated, with higher correlation coefficients indicating stronger test-to-test reliability. Alternate forms reliability involves creating two equivalent forms of a test that measure the same construct. This method assesses the consistency of test scores across different versions of the test. It is particularly useful when practice effects are a concern. Using different forms minimizes the likelihood that respondents will remember test items from the first administration, providing a more accurate measure of the construct being assessed. Key considerations for alternate forms reliability. Equivalence of forms. Both forms must be equivalent in difficulty and content to ensure that differences in scores are due to individual differences rather than variations in the test itself. Calculation. As with test-to-test reliability, the correlation between scores from the two forms is computed to assess reliability. Guideline rule. Test-to-test reliability is generally suitable for measuring stable constructs, e.g. intelligence, personality, when the time gap is managed carefully, while alternate forms reliability is preferable in situations where practice effects are likely to skew results, e.g. educational assessments. What are the potential consequences of low reliability in a psychological test, and how can it affect the validity of the test results? Answer: low reliability in a psychological test can lead to several significant consequences. Reduce predictive validity. If a test is unreliable, it fails to consistently measure the intended trait, leading to inaccurate predictions about future behaviors or outcomes. For example, a poorly reliable personality test might yield different results for the same individual over time, making it difficult to predict their behavior in various situations. Low confidence in results. Inconsistencies in test scores undermine the credibility of the results, causing psychologists, educators, and decision-makers to question the validity of the findings. This uncertainty can lead to incorrect interpretations and decisions based on the test scores. Invalid decisions. Utilizing a test with low reliability in high-stakes situations, such as clinical diagnosis, educational placement, or employment selection, can result in erroneous decisions about individuals. For instance, a candidate might be incorrectly rejected or accepted based on fluctuating scores. Erosion of trust. Repeated use of unreliable tests can erode trust in the testing process among stakeholders, such as clients, parents, or educators, leading to skepticism regarding the assessment process and potentially impacting the therapeutic or educational relationship. Impact on validity. Reliability and validity are interrelated. A test must be reliable to be valid. If a test cannot produce consistent results, it cannot be deemed valid for measuring what it claims to measure. Therefore, low reliability can invalidate the conclusions drawn from test results, as any observed changes in scores may be attributed to measurement error rather than actual changes in the underlying construct. Guideline rule. Psychologists must prioritize the development of reliable tests by conducting rigorous psychometric evaluations. During the test development process, they should regularly reassess existing tests to ensure ongoing reliability and validity. Describe the methods of estimating reliability and discuss their strengths and weaknesses. Answer: there are several primary methods for estimating reliability in psychological testing, each with distinct strengths and weaknesses. Test-to-test reliability strengths provides a direct measure of the temporal stability of the test, useful for constructs that are expected to remain stable over time. Weaknesses: prone to practice effects if the same test is administered too soon, which can inflate reliability. Changes in the construct being measured over time can also affect results. Alternate forms reliability strengths minimizes practice effects by using different forms of the test, helps ensure that any observed score changes are due to actual differences in the construct, not familiarity with test items. Weaknesses: developing equivalent forms can be challenging and time-consuming. If the forms are not perfectly equivalent, the reliability estimates can be biased. Split-half reliability strengths: quick and easy to calculate using a single administration of the test, useful for providing an estimate of internal consistency. Weaknesses: assumes that both halves of the test are equally representative of the overall test, which may not always be the case. The reliability estimate can vary depending on how the test is split. Odd versus even items. Internal consistency Cronbot's alpha strengths provides a comprehensive assessment of how well the items on a test measure the same construct, useful for tests with multiple items assessing the same trait. Weaknesses: high values may indicate redundancy among items rather than diversity of content. It is also sensitive to the number of items, and more items may artificially inflate the alpha coefficient. Guideline rule: choosing the appropriate method of estimating reliability depends on the context of the test and the specific construct being measured. It is often beneficial to use multiple methods to gain a comprehensive understanding of a test's reliability. Discuss the concept of factors influencing reliability and how they can be addressed in test construction. Answer: several factors can influence the reliability of a psychological test, and addressing these factors during test construction is crucial for ensuring consistent and accurate measurements. Test length: longer tests typically yield higher reliability due to better sampling of the construct. However, excessively long tests may lead to fatigue or disengagement among respondents. Addressing this, striking a balance in test length is important. Psychometric analysis during development can help determine the optimal number of items necessary to achieve desired reliability without compromising respondent engagement. Test difficulty and heterogeneity of items. Items that vary significantly in difficulty can lead to inconsistent scores, especially if easier or harder items are concentrated in one half of the test. Addressing this, careful item selection and balancing difficulty across the test can improve reliability. Conducting pilot testing to evaluate item performance can also assist in ensuring a diverse and balanced item pool. Test administration conditions. External factors such as noise, time constraints, and environmental conditions can affect test performance and reliability. Addressing this, standardizing testing conditions, e.g., using quiet rooms, consistent time limits, can minimize variability in test performance. Providing clear instructions and ensuring that all test administrators follow the same procedures are also vital. Test instructions and scoring guidelines. Inconsistent instructions or scoring can introduce variability and reduce reliability. Addressing this, standardizing instructions and developing comprehensive scoring rubrics can ensure that all respondents receive the same guidance and that evaluators apply scoring criteria uniformly. Participant variability. Differences in participant characteristics, e.g., age, education, experience, can impact test results and their consistency. Addressing this, when possible, sample homogeneity should be ensured during the test's development phase. Providing normative data for different demographic groups can also help in understanding how participant variability might influence results. How can improving the reliability of a psychological test enhance its validity? Provide specific examples. Answer: improving the reliability of a psychological test directly enhances its validity by ensuring that the test consistently measures the construct it claims to measure. Here's how improved reliability contributes to enhanced validity. Consistency of measurement. A reliable test yields consistent results over time or across different forms. This consistency means that observed changes in scores are more likely to reflect true changes in the underlying construct rather than random measurement error. For instance, if a depression scale has high reliability, clinicians can be confident that a change in scores between two assessments likely reflects a genuine change in the individual's depressive symptoms, enhancing the test's validity in diagnosing and treating depression. Reduced measurement error. Low reliability often introduces significant measurement error, which can distort the relationship between the test scores and the criteria being measured. For example, a personality inventory with low reliability may yield fluctuating scores for the same individual, leading to misclassifications in personality traits. If the test can be demonstrated to have high reliability, its validity and predicting outcomes based on those personality traits improves, as practitioners can rely on the scores to make accurate decisions. Strengthening correlations with external criteria. Reliable tests show stronger correlations with external validity criteria because the scores are stable. For example, if a new intelligence test is shown to have high reliability, it will likely correlate well with established intelligence measures' concurrent validity. Conversely, if the test is unreliable, any correlation with other measures of intelligence may be weak, undermining its validity. Supporting construct validity. Improving reliability supports the argument that a test is accurately measuring the intended construct. For instance, if an anxiety scale demonstrates high internal consistency, it strengthens the claim that the items are effectively measuring anxiety, thereby providing evidence for the scale's construct validity. Guideline rule. Psychologists developing assessments should focus on enhancing both reliability and validity in tandem, as robust reliability lays the groundwork for valid interpretations and applications of test scores. What are the implications of using a test with high reliability but low validity, and how can such tests be improved? Answer: using a test that exhibits high reliability but low validity poses significant implications. Misleading results. While the test consistently yields the same results, those results may not accurately reflect the underlying construct. For example, a test that reliably measures test-taking anxiety may be inaccurately labeled as measuring general anxiety if the content is not representative of broader anxiety disorders. This discrepancy can lead to erroneous diagnoses and treatment plans. False confidence. Practitioners may develop a false sense of confidence in the results. If a test consistently produces results, users might assume those results are valid, leading to poor decisions based on inaccurate interpretations. Wasted resources. Utilizing a reliable yet invalid test can lead to misallocated resources, whether in clinical settings, e.g., inappropriate treatment plans based on erroneous scores, or educational contexts, e.g., misguided academic interventions based on flawed assessments. Improving such tests involves several steps: item review and revision, conducting a thorough review of test items to ensure they adequately represent the construct being measured. This may involve removing or replacing items that do not align well with the construct. Expert consultation, engaging subject matter experts to provide insights into the content validity of the test. Their feedback can guide revisions to enhance the alignment of test items with the underlying theoretical framework. Pilot testing, administering revised versions of the test to a representative sample to gather data on both reliability and validity. Analyzing this data can help identify remaining issues and areas for improvement. Establishing normative data. Developing normative data for different populations can help enhance validity. When users can compare scores to established norms, the test becomes more meaningful and interpretable. Utilizing multi-trait, multi-method approaches, incorporating multiple measures of the same construct, e.g., self-report questionnaires, observational assessments, can enhance the validity of the overall assessment process by triangulating data from different sources. Explain the role of item analysis in improving the reliability and validity of psychological tests. Answer: item analysis is a critical process in the development and refinement of psychological tests, significantly influencing both reliability and validity. The role of item analysis includes identifying poorly performing items. By analyzing response patterns, psychologists can identify items that do not function as intended. Items with low item total correlations or extreme response distributions may be indicative of issues, enhancing internal consistency. Item analysis helps determine how well individual items contribute to the overall test score. High-performing items that correlate well with total scores contribute positively to the internal consistency, e.g., measured by Cronbos alpha. Removing low-performing items can improve overall reliability, as the remaining items better capture the underlying construct. Evaluating discrimination. Item analysis provides insights into the discriminatory power of each item. Items that effectively distinguish between high and low scores on the overall test enhance the test's construct validity. For example, in the depression scale, items that only a few individuals respond positively to may not effectively capture variations in depression severity. Adapting to cultural and contextual factors. Analyzing item performance across diverse populations helps identify potential cultural biases or relevance issues. Items that do not function equivalently across different demographic groups may require adaptation to improve fairness and validity. Feedback loop for test revision. The results of item analysis provide actionable insights for revising and improving test items. This iterative process allows for continuous enhancement of the test's reliability and validity, ensuring it remains relevant and effective. Guideline rule: regular item analysis should be an integral part of the test development lifecycle, involving ongoing evaluations of item performance to enhance both reliability and validity over time. How do cultural considerations impact the reliability and validity of psychological tests? Answer: cultural considerations are crucial in psychological testing, as they can significantly impact both reliability and validity in several ways. Cultural bias in test items. Psychological tests may contain items that reflect the values, norms, or experiences of specific cultural groups. If test items are not culturally relevant, they may lead to misunderstandings or misinterpretations, adversely affecting the test's validity. For instance, a test developed in a Western context might include references or scenarios that are unfamiliar to individuals from non-Western cultures. Language differences. Language can be a significant barrier in psychological testing. Tests that have not been appropriately translated or that do not account for variations in dialects may lead to inconsistencies in responses. This can affect the reliability of scores, as individuals may not fully comprehend the questions or may interpret them differently due to language nuances. Diverse normative samples. Validity can be compromised if normative data are based on a homogeneous sample that does not represent diverse populations. For example, a test norm primarily on middle-class individuals may not accurately reflect the experiences of individuals from lower socioeconomic backgrounds, leading to skewed results. Cultural differences in psychological constructs. Constructs such as anxiety, depression, or intelligence may manifest differently across cultures. A test designed to measure these constructs might not capture culturally specific symptoms or expressions, affecting its construct validity. For example, expressions of emotional distress may differ in collectivist cultures compared to individualistic cultures. Impact on test administration. The administration process can also be influenced by cultural factors. Differences in social norms regarding authority figures or communication styles may affect how respondents interact with the tester or how they approach the test. This variability can influence the reliability of scores, as individuals from different cultures may respond differently to the same testing conditions. Guideline rule: to enhance the reliability and validity of psychological tests, practitioners should engage in cultural competence training, adapt tests for cultural relevance, and use culturally sensitive assessment methods. This includes conducting thorough research on cultural differences in psychological constructs and ensuring that tests are normed on diverse populations. What role does the concept of construct validity play in the evaluation of psychological tests? Answer: construct validity is a fundamental aspect of evaluating psychological tests, as it assesses whether a test truly measures the theoretical construct it claims to measure. The role of construct validity includes foundation for test development. Construct validity serves as the guiding framework for test developers. Understanding the construct being measured helps in creating items that accurately reflect the underlying theory. For example, if a test aims to measure self-esteem, developers must have a clear definition and understanding of self-esteem to create relevant items. Empirical evidence. Establishing construct validity requires empirical evidence that the test is related to other measures of the same construct, convergent validity, and that it can differentiate between different constructs. Discriminant validity. For example, a test measuring anxiety should correlate with other established anxiety measures, convergent, but not with unrelated constructs, such as personality traits. Discriminant test interpretation. Construct validity is essential for CEOR interpretation of test scores. If a test lacks construct validity, interpretations based on its scores may be misleading. For example, if a depression scale fails to accurately measure depressive symptoms, clinicians relying on those scores for diagnosis or treatment may provide inappropriate care. Ongoing evaluation. Construct validity is not a one-time assessment. It requires ongoing evaluation throughout the test's lifespan. This includes regular reviews of the test's relevance, performance, and alignment with evolving psychological theories and practices. For instance, as new research emerges about the nature of depression, the items on the depression test may need to be revised to remain valid. Regulatory and ethical considerations. Establishing construct validity is crucial for regulatory compliance and ethical testing practices. Organizations that administer psychological assessments often require evidence of construct validity to ensure that tests are not causing harm and are serving their intended purpose effectively. Guideline rule. Psychologists and test developers should prioritize establishing construct validity by conducting thorough theoretical and empirical analyses, utilizing multiple methods of validation, and continually reassessing the test's relevance and accuracy. Explain the concept of test standardization and why it is critical for the validity and reliability of psychological assessments. Include the importance of consistency in test administration, scoring, and interpretation. Answer: test standardization refers to the uniform procedures applied in administering, scoring, and interpreting psychological assessments. It is crucial for maintaining validity. The test measures what it is intended to measure in reliability. The test yields consistent results over time and across different administrators. Consistency ensures that every test taker is subjected to the same conditions, which minimizes variability in results due to external factors rather than the trait being measured. Key points include administration, the conditions under which the test is given, e.g. instructions environment, must be the same for all participants. Scoring, the criteria for evaluating responses should be applied consistently, often through standardized scoring keys. Interpretation, test results should be interpreted based on pre-established norms and standards to avoid subjective bias. Without standardization, results can be misleading, reducing the ability of the test to be generalized across diverse populations or repeated reliably. Describe the differences between criterion-referenced and norm-referenced testing. Why is it important to understand the purpose of each type when designing psychological assessments? Answer: criterion-referenced testing measures a test taker's performance against a predefined set of criteria or a specific level of performance. The goal is to assess whether the individual has mastered the particular skill or content. For example, a math test might have a pass-fail threshold based on achieving 70% of the questions correctly. Norm-referenced testing, on the other hand, compares a test taker's performance to that of a peer group. The individual's score is interpreted relative to how others performed, e.g. percentile ranks. An example is an IQ test where a score of 130 might place a test taker in the 98th percentile. Key differences: purpose. Criterion-referenced tests evaluate mastery of content, while norm-referenced tests evaluate relative standing among peers. Scoring. Criterion-referenced scores are based on fixed standards, while norm-referenced scores depend on how others perform. Understanding the purpose of each is crucial in psychological assessment. For instance, if diagnosing a learning disability, a norm-referenced test helps understand the individual's performance relative to their age group, while a criterion-referenced test may help evaluate whether they meet specific developmental milestones. Maria is a 10-year-old who took a psychological test designed to measure cognitive abilities. The test she took was norm-referenced, and her parents want to know whether the score shows how well Maria masters certain tasks. How would you explain the nature of norm-referenced testing to Maria's parents? Answer: I would explain to Maria's parents that norm-referenced testing is designed to compare Maria's performance to that of other children her age who took the same test. It does not directly measure how well she has mastered specific tasks or skills. Instead, her score indicates her standing relative to a normative group, which is a sample of children of similar ages. For example, if Maria scored in the 85th percentile, it means that she performed better than 85% of the other children who took the same test. However, this score does not necessarily indicate the specific areas where she excels or may need improvement. The test measures her cognitive abilities in comparison to her peers, which can be useful for identifying her strengths and weaknesses in a general sense. I would also clarify that while norm-referenced tests can provide valuable information about how Maria stacks up against others, they should be interpreted carefully. If the goal is to determine specific skills she has mastered, additional assessments or criterion-referenced tests might be more appropriate. This way, her parents can understand the distinction between knowing where she stands compared to others and knowing what specific skills she has developed. How do sampling methods for norm development impact the validity and applicability of psychological tests across diverse populations? Answer: the sampling methods used to develop norms for psychological tests are crucial for ensuring the validity and applicability of those tests across different populations. Here's how these methods can impact test development: representativeness. For norms to be valid, the sample used must accurately reflect the population for whom the test is intended. This means considering demographic variables such as age, gender, ethnicity, socioeconomic status, and geographic location. If a test is normed solely on a homogeneous group, e.g., only white middle-class individuals, it may not accurately reflect the abilities or characteristics of individuals from different backgrounds. Bias mitigation. Non-representative samples can lead to cultural bias, where individuals from underrepresented groups may score lower not due to their actual abilities, but because the test was developed with a specific cultural lens. For instance, questions that are culturally relevant to one group may be confusing or irrelevant to another, affecting scores and interpretations. Sample size. A larger and more diverse sample generally leads to more stable and reliable norms. Small samples can introduce significant variability and reduce the generalizability of results. For example, a test normed on a small, non-diverse group might yield misleading conclusions about the population as a whole. Norm updating. As demographics change over time, it is vital to periodically review and update the norms. This ensures that the test remains relevant and fair as societal changes occur. To achieve validity and fairness, psychologists must prioritize diverse and representative samples when developing norms for psychological assessments. This commitment aligns with ethical guidelines established by professional organizations such as the American Psychological Association, APA, which emphasize fairness and equity in testing practices. Explain the role of age norms in psychological testing. How are age norms different from grade norms, and when should each be used? Answer: age norms are statistical benchmarks derived from the performance of individuals within specific age groups on psychological tests. They are essential for assessing developmental progress and cognitive abilities, as these can change significantly over time. Age norms are particularly valuable in contexts where age-related developmental milestones are important, such as in childhood assessments of intelligence or cognitive skills. Grade norms, however, are established by evaluating the performance of individuals within specific educational grades. This type of norm is particularly useful for academic assessments where the focus is on comparing students' performances within the same educational context rather than across varying ages. Key differences. Purpose. Age norms focus on developmental progress and are used to assess how an individual's abilities align with what is typical for their age group. Grade norms assess academic achievement and are used to determine how well a student performs compared to their peers in the same educational setting. Use cases. Age norms are often used in developmental psychology, child assessments, or in determining eligibility for special services based on developmental milestones. Grade norms are primarily employed in educational settings to evaluate student learning outcomes and to identify those needing remediation or advanced placement. When to use each. Use age norms when assessing cognitive development in children, particularly when measuring skills that are expected to evolve as they age, such as language acquisition or problem-solving abilities. Use grade norms when evaluating academic skills in a school setting, especially when the assessment is intended to inform educational planning or curriculum development. Both age and grade norms help professionals interpret test scores meaningfully and in context, facilitating appropriate interventions and support for individuals based on their specific needs and circumstances. Mr. Edwards, a school administrator, is reviewing standardized test scores for students to determine who qualifies for special education services. The test reports both percentile ranks and z-scores. Explain the significance of these two scoring methods and how Mr. Edwards should use them in his decision-making process. Answer: percentile ranks and z-scores are two different ways of expressing a student's performance on standardized tests, and each provides unique insights. Percentile ranks. Definition: a percentile rank indicates the percentage of test takers who scored lower than a given score. For example, if a student has a percentile rank of 70, it means they scored higher than 70% of the peers who took the test. Significance. Percentile ranks are easily interpretable for educators and parents, providing a straightforward understanding of how a student compares to their peers. They can help identify students who are significantly below the norm, which is often a criterion for special education eligibility. Z-scores. Definition: a z-score expresses how many standard deviations a score is from the mean. For instance, a z-score of -1 indicates that the student scored one standard deviation below the average score of the normative group, while a z-score of 1 indicates one standard deviation above the average. Significance: z-scores provide a more precise measurement of a student's relative performance and can be useful in statistical analyses. They allow for comparisons across different tests that may have different scoring systems. Decision-making process. Mr. Edwards should consider the following steps when reviewing the scores. Identify the thresholds. Determine the specific cutoff scores for special education eligibility within the context of both percentile ranks and z-scores. For example, the common cutoff might be below the 10th percentile or a z-score of -1.5 or lower. Contextual interpretation. Use percentile ranks for straightforward comparisons with peers. If several students fall below the 10th percentile, it may indicate a broader issue that needs addressing at the school level. Further evaluation. Utilize z-scores to conduct more in-depth analyses. If a student has a z-score of -2 but is at the 15th percentile, this indicates significant underperformance relative to their peers, warranting further assessment. Discuss how cultural factors can influence the validity of psychological assessments. What measures can be taken to minimize cultural bias in testing? Answer: cultural factors play a significant role in shaping individuals' experiences, values, and behaviors, which can influence the outcomes of psychological assessments. Here's how cultural influences can affect test validity. Influences on validity. Test content. If a test includes items that are culturally specific or unfamiliar to certain groups, it may unfairly disadvantage those individuals. For instance, questions about cultural references that do not resonate with all populations can skew results. Language and dialect. Tests that are not adequately translated or that do not consider regional dialects may misinterpret a respondent's understanding or ability, leading to inaccurate assessments of intelligence or competency. Social norms and values. Different cultures may prioritize various traits or skills. For instance, a test that rewards assertiveness may not be suitable in cultures that value humility and collective behavior, impacting scores and interpretations. Measures to minimize cultural bias. Culturally sensitive test development. Engage diverse cultural experts during the test design phase to ensure that test items are culturally relevant and fair. This can involve using focus groups from various backgrounds to provide insights into cultural contexts. Norming on diverse samples. Develop norms based on a broad and representative sample that includes various cultural groups. This helps ensure that the test reflects the diversity of the population it serves. Use of alternative assessments. Incorporate multiple forms of assessment beyond traditional testing methods, such as performance-based tasks, interviews, or portfolio assessments that allow for a broader evaluation of an individual's abilities and experiences. Cultural competence training. Psychologists and assessors should receive training in cultural competence to understand and recognize their own biases and how culture impacts behavior and responses during assessments. Regular review and update. Continuously assess the relevance and fairness of tests in light of changing cultural contexts and demographics. This ensures that the assessments remain appropriate and valid for the populations they are used with. What is the role of reliability in psychological testing, and how can different types of reliability, test-your-test, iterator, internal consistency, affect test interpretation? Answer: reliability in psychological testing refers to the consistency and stability of test scores over time or across different conditions. It is a crucial aspect of psychometric evaluation because it determines the extent to which a test produces stable and consistent results, which is essential for interpreting the findings meaningfully. Types of reliability. Test-your-test reliability. Definition. This type measures the consistency of test scores when the same test is administered to the same individuals at two different points in time. Impact on interpretation. High test-your-test reliability suggests that the test is stable over time. For example, if a student takes an IQ test today and again in 6 months and scores similarly, it indicates that the test effectively measures stable cognitive abilities. Low test-your-test reliability could suggest that the test may be affected by external factors, e.g., mood, anxiety, or that it measures skills that naturally fluctuate over time. Iterator reliability. Definition. This type assesses the degree to which different raters or observers provide consistent estimates of the same phenomenon. Impact on interpretation. High iterator reliability indicates that multiple evaluators are likely to produce similar scores, suggesting that the scoring criteria are clear and applied uniformly. For example, in observational assessments, if two psychologists rate the same child's behavior and arrive at similar conclusions, this indicates that the test can be reliably interpreted across different evaluators. Conversely, low iterator reliability suggests potential bias or inconsistency in scoring, which could lead to inaccurate assessments. Internal consistency. Definition. This type measures whether different parts of a test yield similar results. It is often assessed using statistical measures such as Cronbach's alpha. Impact on interpretation. High internal consistency means that all items on a test measure the same underlying construct. For instance, in a depression inventory, if items designed to measure the same aspect of depression correlate highly with one another, it indicates that the test is likely measuring a coherent construct. Low internal consistency may suggest that some items are irrelevant or measure different constructs, which can lead to confusion in interpreting scores. Overall impact on test interpretation. Reliability directly influences the confidence psychologists can have in test scores. A test that lacks reliability may produce misleading results, affecting decisions related to diagnosis, treatment, or educational placement. It's essential to evaluate the reliability of a test alongside its validity to ensure that the conclusions drawn from the assessment are both accurate and meaningful. Psychologists should prioritize the use of tests with established reliability metrics and remain vigilant in interpreting results with an understanding of the reliability of the assessments being used. Discuss the importance of ethical considerations in psychological assessment. What are some potential ethical dilemmas a psychologist might face, and how should they navigate these challenges? Answer: ethical considerations in psychological assessment are fundamental to ensuring the integrity of the testing process and the welfare of clients. Psychologists are responsible for conducting assessments that are fair, unbiased, and respectful of the individual being tested. Key ethical principles include importance of ethical considerations, informed consent. Individuals should understand the nature and purpose of the assessment, including any potential risks and benefits. This ensures that clients can make informed choices about their participation. Confidentiality. Test results and personal information must be kept confidential to protect individuals' privacy and maintain trust between the psychologist and the client. Competence. Psychologists must be adequately trained and knowledgeable about the tests they administer to avoid misinterpretation of results, which can lead to harm or inappropriate decisions regarding treatment or placement. Fairness and non-discrimination. Ethical assessment practices require psychologists to be aware of and minimize cultural biases, ensuring that assessments are equitable and appropriate for diverse populations. Potential ethical dilemmas. Conflicts of interest. A psychologist may be asked to assess an individual in a context where they have a personal or financial stake. Navigation. In such cases, psychologists should disclose any potential conflicts and, if necessary, recuse themselves from the assessment or seek an independent evaluator. Pressure to provide favorable results. Psychologists may face pressure from stakeholders, e.g., parents, schools, to provide positive assessments to secure services or educational placements. Navigation. Psychologists should adhere strictly to ethical guidelines and present objective findings, regardless of external pressures. It is crucial to emphasize that the welfare of the client is the primary concern. Cultural sensitivity. Assessments designed for one cultural group may not be valid for another, leading to biased results that can have significant consequences, such as misdiagnosis or inappropriate interventions. Navigation. Psychologists should utilize culturally appropriate assessment tools and consult with culturally competent colleagues to ensure the validity of their evaluations. Describe the process of norming a psychological test. What factors must be considered to ensure that the norms are appropriate for the intended population? Answer: norming a psychological test involves establishing standard scores for comparison against individual scores. The key steps in this process include sample selection. Choose a representative sample of the population intended for the test, ensuring diversity in demographics such as age, gender, and ethnicity. Data collection. Administer the test to this sample under standardized conditions to collect performance data. Statistical analysis. Calculate key statistics like mean scores and standard deviations to understand the distribution of scores. Development of norms. Create normative tables that display how individual scores compare to the overall sample. Factors to consider. Population characteristics. The sample should reflect the target population's diversity to ensure generalizability. Cultural relevance. Ensure that the test items are appropriate for the cultural context of the intended population to avoid bias. Age considerations. Stratify norms by age, particularly for tests used with children or adolescents. Geographical diversity. Include participants from various regions to account for potential regional differences in test performance. By carefully following these steps and considerations, psychologists can develop valid norms that enhance the accuracy of psychological assessments.